Good evening, folks. Tonight's discussion deals with the dangers of cannabis use among older adults. So, the presentation I made for you tonight deals with cannabis use among older adults. Here we go with tonight's presentation. Please join me. Here we go. Here's a clear, grounded explanation of the article you're reading based primarily on the page content you opened. What the article is saying in plain language. Cannabis use among older adults is rising fast. The article notes that cannabis use among people 65 plus has jumped from nearly zero in the 1990s to about 7 to 8% in 2023. Doctors are seeing more older patients using it regularly, often assuming it's safe because it's legal and widely available. Doctors are worried not because cannabis is evil, but because older bodies are more vulnerable. A UCSF physician describes a patient with heart disease who smokes cannabis and doesn't believe it's risky, but clinicians emphasize that there's not enough evidence to say cannabis is safe for older adults, especially those with chronic conditions. The core message. Older adults metabolize drugs differently, take more medications, and have more fragile systems, so even mild substances can have outsized effects. The biggest risk isn't what most people expect. The article hints that the main danger isn't addiction or lung damage, it's how cannabis interacts with aging bodies and existing medical conditions. Heart disease, smoking cannabis can stress the cardiovascular system. Balance and falls. THC can cause dizziness or slowed reaction time. Cognition. Older adults may be more sensitive to confusion or impaired judgment. Polypharmacy. Cannabis can interact with common medications. These risks are amplified because many older adults use cannabis for sleep, anxiety, or pain, even though the article notes that the evidence for those benefits is weak, and cannabis may actually worsen sleep or anxiety for some people. The article stresses uncertainty. Doctors aren't saying never use cannabis. They're saying we don't have strong evidence that it helps the condition older adults use it for. We do have evidence that older adults are more vulnerable to side effects. And we definitely don't have evidence that it's harmless. Why this matters. The article frames this as a public health blind spot. Cannabis use is rising among seniors, but research hasn't kept up. Meanwhile, older adults have older adults may assume legality equals safety, and clinicians are seeing the consequences. In short answer, cannabis becomes more medically complicated as you age, and the biggest dangers aren't the ones most people expect. For older adults, the most consequential risks are falls, drug interactions, and cardiovascular strain, not simply getting high. A conversation with your clinician is essential before starting or continuing use. How cannabis risks shift as we age. Aging changes how the body processes substances, metabolism slows, balance becomes more fragile, and most people accumulate medications or for chronic conditions. Cannabis, especially today's high potency products, interacts with all of these age related changes. The result is a risk profile that looks very different at 70 than it does at 30. What doctors are seeing and why they're concerned. Cannabis use among adults 50 plus and 65 plus has surged, often for pain, sleep, anxiety, or mood. But the products available today are far more potent than those used decades ago, with THC levels 5 to 20 times higher than that means accidental overconsumption is common, especially with edibles that take 1 to 3 hours to kick in. High THC formulations can overwhelm older nervous systems, leading to confusion, panic, or prolonged impairments. Falls and medication interactions, not intoxication, are driving ER visits among older adults. Doctors emphasize that these harms are often indirect. A single fall can lead to fractures, hospitalizations, or long term loss of independence. A single drug interaction can destabilize blood sugar, blood pressure, heart rhythm, or anticoagulation. Practical evidence based guidance for older adults. These steps reflect what geriatricians, cardiologists, and addiction specialists recommend. Talk to your clinician first. Bring a full list of medication and supplements and doses, interactions with blood thinners, sedatives, antidepressants, and heart medications are common and sometimes dangerous. Start low, go slow, and stay low. Older adults often need much smaller doses. Begin with CBD dominant or very low THC products. Increase only in tiny increments. Wait several hours before taking more, especially with edibles. Avoid smoking or vaping. Smoking and vapor inhalant, the lungs and increased cardiovascular strain. Tinctures or low dose edibles are safer routes, but still require caution. Protect against falls. Use cannabis only when seated. Avoid stairs and don't use it when home alone. If you're unsteady, never drive afterward. If you have heart disease, cognitive impairment, or take multiple medications, you may be in higher risk category. A specialist, geriatrician, cardiologist, or pharmacist can help assess safety. Bottom line, cannabis is not automatically unsafe for older adults, but it is absolutely not risk free. The most serious dangers are the ones people tend to overlook: falls, drug interactions, and cardiovascular strain, all of which can have outsized consequences later in life. If you choose to use cannabis, do so deliberately, cautiously, and with medical guidance. Discuss at your next appointment, including symptoms, goals, and medication lists. Okay, guys. Those are your shows for tonight. I will be back on tomorrow for shows. For now, Gator Wellness. Take care, folks. Have a good evening.